In the realm of mental health, psychiatry has long been regarded as the cornerstone of diagnosis and treatment. However, recent scrutiny has cast doubt on its fundamental principles, particularly regarding the nature of mental disorders. Despite extensive investment and research, the elusive quest to validate mental illnesses as physiological brain abnormalities has yielded inconclusive results. For decades, psychiatry has positioned itself as a medical discipline, asserting that conditions such as depression, anxiety, and schizophrenia stem from neurological imbalances or structural abnormalities in the brain. This narrative has guided treatment approaches, including the widespread use of psychotropic medications aimed at correcting these purported deficiencies. Yet, despite the immense resources dedicated to uncovering the biological underpinnings of mental disorders, the evidence remains elusive. Studies seeking to identify consistent biomarkers or neurological signatures have yielded inconsistent and conflicting results. The simplistic model of chemical imbalances as the root cause of mental illness has been called into question, challenging the very foundation of psychiatric practice. In light of these challenges, an alternative perspective emerges. Mental disorders are primarily a product of environmental influences rather than inherent biological abnormalities. This paradigm shift acknowledges the complex interplay between genetics, psychology, and environmental factors in shaping mental health outcomes. Indeed, research increasingly points to the significant role of environmental stressors, early life experiences, socioeconomic disparities, and cultural influences in predisposing individuals to mental health challenges. Adverse childhood events, social isolation, trauma, discrimination, and economic instability are recognized as potent contributors to the development of mental disorders. Moreover, the over-reliance on pharmaceutical interventions has come under scrutiny, with concerns raised about their efficacy, long-term effects, and potential for overprescribing. The medicalization of normal human experiences and emotions has raised ethical questions about the pathologizing of natural variations in mental states. Critics argue that the biomedical model of psychiatry overlooks the holistic nature of mental health, neglecting social, cultural, and psychological factors that significantly impact well-being. The reductionist approach fails to account for the complexities of human experience and the diverse manifestations of distress. Moving forward, there is a growing call for a paradigm shift in mental health care, one that embraces a multidimensional understanding of mental well-being. This approach emphasizes prevention, early intervention, social support, and holistic treatment modalities that address the root causes of mental distress. In conclusion, the narrative surrounding mental health and psychiatry is evolving, challenging conventional wisdom and calling for a more nuanced understanding of mental disorders. By recognizing the intricate interplay between genetics, environment, and psychology, we can better address the complex realities of mental health and cultivate a more compassionate and effective approach to care.